I'm Cory Rosenbaum, and I'm a medical malpractice lawyer in New York and founder of strokelaw.com. First, I want to talk to you about what exactly is stroke. What happens when someone suffers a stroke? A stroke is nothing more than an interruption in the blood flow and the oxygen getting to somebody's brain. It's usually caused by a clot or by an artery bursting and causing bleeding on the brain itself. The signs and the symptoms of a stroke or the impending stroke that a person may suffer can fall into the moniker of F.A.S.T. Face, meaning facial drooping or a facial change. Arms, can a person lift their arms up to equal distances over their head? Has their speech, the letter S, speech, has their speech pattern changed? Are they stuttering or just speaking differently? And most importantly, time. Time is of the essence in recognizing and treating stroke to get the oxygen restored to that person's brain as quickly as possible. There are other signs of stroke that you should know and that doctors and hospitals should know. For one thing, visual disturbances. When there's an impending stroke or someone is suffering a stroke, they'll often see bright lights in their scope of vision or blurriness, or their vision from the right and the left eye may suddenly be different. People who suffer headaches may be at risk of suffering a stroke because a headache, either a sudden headache, a prolonged headache, or an extremely painful headache, is also a sign of an impending stroke. Sudden loss of memory is a sign and a symptom of stroke and an impending stroke. Treating someone who is suffering and showing the signs of an impending stroke. 3 letters, TPA, TPA. Tissue, plasminogen, activator. Fancy words for a clot-busting drug. This drug needs to be administered as quickly as possible to thin the blood, break up the clot, and restore the blood flow and the oxygen to the brain. There are very common mistakes that doctors and hospitals make when they're treating victims of stroke, and these are the causes of many medical malpractice cases. Common mistake number 1. Not recognizing the signs and the symptoms of a stroke. Number 2, sending the patient home without treating the impending stroke or the stroke the person is already suffering. Number 3, not treating the patient fast enough. Time is brain. The faster the doctors get that clot broken, the faster the blood flow is restored, the less brain injury that person will suffer. Another common mistake is a hospital failing to recognize that they are unable to treat the stroke victim in their own facility. If a hospital does not have the ability to treat it, does not have the ability to administer the TPA drugs, they need to get that patient to another hospital that can as quickly as possible. I'm Cory Rosenbaum, and if you have questions regarding stroke, hospitals, doctors, or any other questions, please feel free to call us.